So you're big on oral sedation in your practice.
Yeah, we use oral sedation a lot, Randy. And you know, everybody thinks that they're the most afraid of the dentist, but really everybody's afraid of the dentist.
Yeah, okay.
So we use oral sedation in our office most of the time, and it really just consists of a pill the night before and a pill the day of. And the patient comes in, they're very relaxed. And the beautiful thing is, too, is they forget later on.
Oh, is that right?
Yeah.
They forget about the procedure.
Yeah, which is really great. And sedation's also good for the other type of patient who has no time to come to the dentist. Because if you're too busy and you can't get there, we can do 2 or 3 appointments in one appointment if you're sedated.
So sedation allows them just to, like if somebody has a bunch of kids or a busy is that really an excuse? They'll say, I just don't have the time?
Of course. You hear mothers saying that all the time.
Okay.
Yeah. And you know, then they'll come in and say, I know I have to take care of myself, but I have all my kids. So yeah.
So oral sedation just allows you to do a lot more stuff in one sitting.
Exactly.
Is that right?
And for the mother with all the kids, it gives them a little relaxation.
Okay. And the phobics love it the most? Like the people that are really afraid?
Yeah, and you know, honestly, with sedation, we find that after they come to us a couple of times, they really don't need the sedation anymore.
So, oh, really? Okay.
Yeah, and that's the best part of it, because then we know we won them over.